Hello, my name is Paul Saunders. I'm a proud Biripi man who lives and works on Dharawal country in southwestern Sydney. I'm a senior lecturer in Indigenous Health at the University of Wollongong, and I'm also a first governance group member.
Hi everyone, my name is Tiana. I'm the Aboriginal Population Health Programs Coordinator at South East Sydney Local Health District. I've got family ties up the northern part of New South Wales, up Biripi Way, and then through to Darkinjung on the Central Coast, but I am born and raised out on Darug land in Penrith, currently working in South East Sydney.
Hi everyone, this is Rob Monaghan. I'm a Bundjalung Gumbaynggirr boy from the North Coast, New South Wales. I am the manager of the Aboriginal Health and Torres Strait Islander Research Unit at the Kerb Institute within UNSW.
My name is Antoinette White. I'm a Palawa, an Indigo woman living on Turrbal country, Meerjin, Brisbane, and as an active community member. I'm passionate about Aboriginal and Torres Strait Islander health and wellbeing, with a real key interest in strengthening our Indigenous data sovereignty and governance practices.
Hello, my name is Katrina Clark, and I'm a proud Barkindji woman from far western New South Wales. I'm on the beautiful lands of the Awabakal people, and I acknowledge and thank them for looking after the land that I have lived and worked on for the past 30 years. I am the Aboriginal Immunisation Manager within Hunter New England Local Health District.
Yamandimarang. I hope you're well today. My name's Alison Barnes and I'm a proud Wiradjuri woman. I'm also a nurse and a researcher at Western Sydney, and I have long COVID. Being involved with FIRST for me was about making sure that the perspectives and needs of people with long COVID were being listened to and respected. And not everyone with long COVID has the capacity to be involved with things. And while I feel like I'm getting better, and I can now, I think I should, because this is my community and I want to take care of them.
I joined FIRST because of the wonderful opportunity this platform provides to ensure that there is a First Nations perspective on pandemic preparedness and research. There is a great opportunity also to engage with other key health partners and agencies to listen to us as a national All First leadership group.
I joined the prize last year to become an active member of our First Governance group. I hope to contribute by identifying and communicating any cultural safety risks within the policies, practices and governance of their prize projects for the escalation to the prize executive if needed. I will support and empower other First Nations members in a culturally safe manner.
I joined FIRST because I saw the great response from Aboriginal communities all over Australia in relation to the COVID-19 pandemic. And I saw the strength of the leadership and the resilience of my local community, the Dharawal community, and how they reduced the number of infections, but also supported the community through vaccinations and supporting elders to ensure they had access to medications and food.
I think during 2020, when the pandemic hit, it was really clear that there was such a limited number of Aboriginal champions in the public health space. I wanted to be a part of a group, strong Aboriginal voices that can advocate at a national level for our communities. And I want to be at the table when these decisions are being made for our communities and about our communities.
I joined the First Nations Preparedness Research Network to give Aboriginal people a voice and also to make sure that Aboriginal people's voices are heard.
I think actively involving Aboriginal staff at every point in the research, so the planning or the scoping, the implementation and the evaluation. I hope that the First Governance group here, we can champion that message to promote meaningful knowledge exchanges between our Aboriginal staff, non-Aboriginal allies, and then down through our communities who, at the heart of everything we do, they are it.
There's a lot of lessons that can be learnt from the response of Aboriginal communities to COVID. And my hope is that this group advocates for those communities and those responses and sheds a light on the ways in which Aboriginal communities can work together and how that leadership approach and that communal approach can then be transferred to non-Aboriginal communities to ensure that future pandemics are contained and reduce mortality.
My hope for the future pandemic response for First Nations people is that the voices of First Nations people are heard, listened to, and actioned. It is important to be ready for the next pandemic, and by centering the voices and experiences of First Nations people is the correct way to ensure that the responses are culturally responsive and culturally informed for First Nations peoples.